The Oncotype DX test is ideally suited for men with low-grade prostate cancer that are interested in active surveillance. We want to know, by looking at the inner workings and the genetic structure of these lower-grade cancer cells, if these cells will indeed behave like lower-grade prostate cancer. So we'll get the score, and that score will let us know whether these cancer cells are going to behave like a Gleason 6 or whether they're going to behave like a lower volume Gleason 7, 3 plus 4, or whether they're going to behave like a higher volume 4 plus 3, or even a Gleason 8, 9, or 10. It's important that we know this. We take risks with active surveillance, and those risks are low. But this test, the Oncotype DX test, should decrease the risk of us missing any cancers that could potentially behave more aggressively, that don't look as aggressive from a pure pathologic diagnosis. At the end of the day, the Oncotype DX test is ideally suited for men interested in active surveillance and who also want to know more information about their prostate cancer such that they can sleep better at night knowing that this indeed is a lower grade cancer and has a less chance of growing while we're following that cancer very closely.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.